And today we're going to talk about rest and exercise and some things that you might want to use to incorporate exercise back into your daily lives. And I'll bring forward some of the things that you've learned from Bob and from Becky. And did you have Julie or Penny this week or this round? Not sure? Okay, so basically just trying to bring together everything that you've learned from each of the other sessions in relation to rest and exercise. What happens after a brain injury? There are metabolic changes, which means there is a change in the way our brain functions. For example, because our brain plays a role in regulating blood flow and pressure, we may experience higher resting heart rates and or faster increases in heart rate and pressure with exercise. This helps us to understand why we may feel exercise now makes us more tired or requires more effort. Another functional change that impacts participation in exercise is changes in visual processing, which impacts our balance and our ability to tolerate or move around in busy environments. What sometimes happens after someone's had a brain injury is they go in, they get an X-ray or an MRI, and they might be told that their MRI and X-ray is absolutely clear. And that can be very disheartening for some people because they know that something is wrong, something's not right, but the X-ray or MRI is showing that they're fine. And that often happens. The majority of people who have a mild traumatic brain injury won't show changes on an X-ray or MRI. And that's because those types of tests show only structural changes. They don't show functional changes. Okay, so when we talked about metabolic changes, that's not something you can really see by taking a picture. It's a change in the way that the brain functions. So there is new imaging techniques that are coming down the pipeline in research, and this is just of a picture to show you one research study that was showing how the brain operates differently in somebody who's had a concussion or a mild traumatic brain injury versus somebody who's had a severe brain injury. And so this fancy machine, what it does is it shows the difference in how hard the brain is working or how much activity is going on at the level of the brain. Okay? So for this person over on the far right, this is somebody who's normal or considered normal. They haven't had a brain injury. So they have all this yellow and red that you see. That means that there's lots of activity going on. Okay? Then this person in the middle is someone who's had a severe brain injury. This person's in a coma, okay? And so it's very blue. There's not a lot of activity going on. And then this one over here is somebody who's had a mild traumatic brain injury, okay? Still not a lot of lighting up in the similar way that we see in somebody who hasn't had a brain injury. So this tells us that yes, there is something going on after someone's had a mild traumatic brain injury, and it's functional, and so that might be why you're not seeing it on those structural images like an X-ray and MRI. So when I'm working with my clients and wanting them to understand the effects of exercise, it's one of the things that we'll often use to help people out in returning to activity after they've had a brain injury. So the reason why we like exercise is because regardless of whether or not you've had a brain injury, exercise makes your body release these feel-good hormones that we call endorphins. So if you've ever heard somebody talk about the runner's high that they get, basically when you're stressing your body through exercise, it makes your body secrete hormones that make you feel better. Okay, so that's why they report that exercise can be used to help reduce feelings of depression, anxiety, and stress, and therefore can help to improve your sleep, your mood, and helps to improve our stamina or our activity tolerance, so we're feeling less fatigued if we're more physically active. And another added benefit is it helps us to regulate our blood pressure and risk of other chronic illnesses as well. But when we talk about exercise and participating in exercise, that can mean many different things to different people. And so I just want to spend a little bit of time talking about some of the different types of exercise that are out there because it is a very broad concept. So there's things like cardiovascular and aerobic exercise, which could be something like biking, swimming, walking, or running. There's strengthening or resistance training, where you're trying to improve the strength of your muscles and joints. So that might be using weights like barbells or dumbbells. That could be using resistance bands to try and do some activities similarly to what you would do with a barbell. And you might see using some different weight machines at the gym. Okay. Other types of strengthening exercises might not involve any equipment at all, or what we call body weight exercises. So just standing and doing squats without the use of a weight. That's still a strengthening exercise, but you're going against the resistance of your body weight. Okay? There's also balance training, and we'll talk a little bit later on about some balance exercises you could incorporate into your daily program. But that could also be things like doing Tai Chi, which could also have the added benefit of being a relaxation exercise, which is something that you guys learned last week with Bob. Or yoga. Yoga and Pilates, those are two different types of exercise programs that you could use that would incorporate balance and strength. And we like to joke around that in order to be discharged from physiotherapy, you have to be able to do this fancy pose. But I'm really not that mean. So I'm going to get you guys started on some homework. And so I want you to think about what you might need in order to get started with getting exercise back into your life, or incorporating it into your life if that's something new to you. The first thing I want you to think about is something that you enjoy doing. I don't think people should go out running if they hate running. I don't think people should go swimming if they hate swimming. I want you to think about something you love to do, and that's going to be your starting point. You can find a partner. Doing exercise with another person can help to keep us on task. It makes it more enjoyable, whether that's spending time with a spouse or a friend. I have one former client who used to have his cat that would go with him, and so that's what made it enjoyable for him. Starting gently. So if you were a marathon runner before, for example, don't try and go out and run 10K right away. We want to try and find a starting point that you're going to be successful with, and that can sometimes be the most frustrating piece, because what you've understood so far is that not everybody's brain injury is the same, and so not everybody reacts in the same way to the same amount of exercise. So finding that starting point can be a struggle in the beginning. So that's why we want to try and start with something small. My fellow that I said started with walking with his cat, he was just going to the end of his one car length driveway and back. And that's how he started. The other thing that you're going to do is to schedule the activity into your day. So Becky talked to you guys about using agendas or timers. So you're going to use that agenda or timer to write in your activity that you want to do and when. The other thing that you need to do if you're going to schedule that in is plan a rest for afterwards. Do you remember those pacing and planning graphs that you guys learned either in triage or with Becky as well? So you have to make sure that you plan your rest for afterwards. We're also going to progress slowly but consistently. So it's important that if we go from walking 5 minutes in our first week, that we don't try and double it the next week, because that can be a significant stress on our system. So if we do 5 minutes the first week, maybe we're just going to go up another 2 minutes the next week, and we're going to go up to 7 minutes. So progressing slowly can ensure that success, but we want to do it consistently so that we can keep the ball moving forward. This last concept is sometimes hard for us to wrap our heads around. And it's this idea that no matter how you feel each day, you want to try and just do something. It can feel very rewarding to accomplish at least one thing each day, even if we're feeling like we can't even get out of the house that day. So maybe it's just doing one balance exercise that day. Maybe it just means walking to the end of my driveway and back. But just doing something will help to build those small successes for you and helping to maintain your confidence moving forward. Paying attention to how you feel. Again, that's one of the things that you guys would have learned with Becky and writing out your agendas. Thinking about how you felt after you did an activity will help you in guiding to figure out how much further am I going to progress this next time I next time I go for a walk. So if you go for a walk for 10 minutes and you know that an hour later I was still not feeling like I could do anything else that day, it really put me out, then maybe that should be a sign to you that doing 10 minutes of walking is too much in one session. So maybe you want to back it off and only do 5 to 7 minutes next time. But writing it down is really going to help with our memory, right? And then it helps you to look back and see how you've progressed moving forward. Okay? So just as a friendly reminder, our planning and pacing drafts, if we're going to incorporate activity into our day, we don't want to incorporate something that's going to make us go into the red zone and stay there and make us crash the next day. We want to do something that's that we can plan and pace out through our days. Okay, so what you do once you find your pulse is try and count how many beats were there in 10 seconds or a minute, because what you want to figure out is how many beats per minute. I don't like doing math in my head, so I watch my clock until the second hand's gone all the way around for the full minute, and then it makes it easier for me to focus on just counting the beats. Okay? So then you figure out what your heart rate is in beats per minute, and then we determine your training zone. So what we've recommended for most people is to start off with a training zone of 60 to 70% of their maximum heart rate. Okay, and we're going to calculate that together. So in the front part of your package, you have the list of all the slides that we've done together. And the next page after the last slide should be an explanation on how to measure your heart rate. So to calculate your target heart rate, what you do is find first your maximum heart rate. And to calculate your maximum heart rate, you're going to start with 220 and minus your age in years. Okay? So if I was 20 years old, which I'm not, I would say that my maximum heart rate is 200. Okay? Does that make sense? Okay. So then what you're going to do to find your exercise range is you're going to take that number that you calculated in the first line, and you're going to multiply it first by 0.6 to find your 60% of your max heart rate. So if in our example, if my max heart rate was 200, then I'd multiply 200 by 0.6. And then if I wanted to get the upper range of that training zone, then I would take 200 and multiply it by 0.7. Okay? And so that would give me my range. Okay? So you guys can calculate out what yours is for you. And if, like me, you don't like doing calculations, as I said before, I think I put in, there is a training chart that has, if you're this old, then your training heart rates for this, and this percentage are X, Y, and Z. And if it's not in your package, then I can bring it in 2 weeks' time when we come to the drop-in session. Okay? So heart rate's one way you can measure intensity. Hopefully that gives you some ideas on how to do that. You could also use a heart rate monitor. There's nothing wrong with using that. Just the finger and pen method I find is a lot cheaper, so I like to do it that way. The other thing that you can use is something called a Borg scale. So Borg was this researcher who looked at how the consistency in how somebody rated how hard they felt they were working in relation to how high their heart rate was. So they then developed this scale where you can do whatever activity that you're doing, and based on how you feel, you report how hard you feel you're working. Okay, so there's also a copy of this in the appendices of your package as well. But if I was going for a walk and was thinking about how hard I felt that I'm working, I could pull out my Borg scale and say, I feel like I'm working at about a 3 or 4 out of 10. So that's a moderate to sort of hard, according to the Borg scale. Okay? And usually, when we get people starting off and we're thinking about what's that idea of starting gently mean, we want them to start at either a 5 or less. So 5 is can be considered hard. We want to push our systems a little bit, but we don't want to extend beyond that in the beginning. Okay? So the next sheet's either in your appendices or you can follow along on the slides, is we're going to figure out plans for each of you. So what I want you to think about, you can either write it down or think about it in your head, of an activity that you'd like to do. You're going to write down how you're going to measure your starting intensity. Are you going to do it by your heart rate? Are you going to do it by the length of time you're going to work on it? Number of repetitions? Are you going to use the Borg scale? Then I want you to think about where you're going to schedule that into your agenda. What time of day are you going to do that activity? Okay. The other thing I want you to do is think about how you're going to track your progress. So moving from one week to the next, are you going to write down your symptoms that you had with that one activity, how far you went, what your heart rate was, how are you going to track change? And then what I want you to do is to make 2 goals for yourself. One is a short-term goal of how you might, your goal might be to create a plan for yourself in the next week. It might be to start walking 5 minutes 3 times a week in the next 3 weeks. So that might be a short-term goal for you. A long-term goal might be that within 6 months, I would like to be walking 20 minutes most days of the week, or something like that. Okay. All right, so I'm going to give you guys some time to try that out and write some stuff down, and then I'll ask you guys what your plans were. So we talked a little bit before about how balance is a type of exercise that we might want to incorporate back into our lives, because some of us might find that our balance has changed after we've had our injury, and that is very, very common because our balance is impacted by our vision system, something called our vestibular system, which is in our inner ear, and your proprioception, which is another type of your sensory system that has receptors in your skin that tells your body where you are in space. So there's lots of different things that you can do to work on your balance. That's the best part about it. It's easy to work on. And so one of the things that you can do is if you're standing at your kitchen counter or in the bathroom after you've brushed your teeth, you can try standing on one leg and try and see if you can hold it for 15 seconds. So that's a way to work on your balance. Okay. Another thing you could do is something called tandem walking, where you're walking heel-toe, just like this, trying not to look at your feet. So this challenges your balance because it's narrowing how far your feet are apart. Okay. All right. So sometimes I tell people when you're going to the washroom, if it's not an emergency, try and see if you can do tandem walking on the way there and on the way back. And then maybe after you wash your hands, see if you can stand on one leg and count for 15 seconds. So just a way to sort of integrate balance retraining into the things that you already have to do in the run of a day, but doesn't take up a big chunk of time. Grapevine walking, if any of you are into line dancing, that's all that is you're walking, crossing one foot over the other as you walk from side to side. Okay? And feel free, I'm sure that Bob would tell us that positive thinking is great for us if you want to add in some music and some clapping. There's nothing wrong with that. The other way in which you can make some of these balance exercises more difficult is by either closing your eyes or moving your head. So what I mentioned before is our balance is not only affected by our core strength and our proprioception, but also our vision impacts our balance. So standing on one foot seems pretty easy when I have my eyes open. When I close my eyes, it's not as great. Okay? So that's one way I can make the balance activity a lot more difficult. The other way in which you can make it more difficult is by turning your head from side to side. Because that thing I was talking about called the vestibular system helps tell our brain where our head is in space. And so if you're moving your head from side to side, you're making it more difficult for that system to help out your balance. Okay? So as I said before, our vision changes. They're very common after having a brain injury. And if you're still unsure whether or not you've had any changes in your vision, you might think of some of the different complaints that are similar to a lot of our other clients that we see. So Julie might have touched on this with you as well as Becky, but if you're having trouble with reading, if you're sensitive to light, you don't like being in busy environments like Walmart, if you can't watch TV or spend time on the computer for too long, that might mean that you are having trouble with your vision. If you feel nauseous or overwhelmed in the car, if you feel like you're car sick a little bit more often than you did previously, that could be a result of changes in your vision system. And if you find that you bump into things more easily, so if you're walking down a busy hallway, for example, and you run into somebody and normally you didn't really have to think about having to maneuver in and out of other in and out around other people before, or maybe you turn a corner too quickly. I still do that all the time, so I turn corners too quick. I'm always in a rush. So we talked about treating our balance. We can make it harder by closing our eyes or turning our head from side to side, but there are some other strategies that you can work on as well. So these are specific to working on your vision and vestibular systems, and you can do something called near-far focusing. So all that is trying to focus on something that's close to you and switching to looking at something that's far away. So if you're driving, for example, you would have to look between the odometer and the car in front of you, or the odometer and a sign, right? So if you're sitting at home and if you have a book or a newspaper or a pen with a large font on it, which that one does not have, then you can try and hold that object in a way that the image is crisp and clear to you, and then find something that's further away that you can read clearly. And then you're just going to practice trying going back from the object that's close to you to the object that's far away. You can time yourself for a minute and see how many times you can go back and forth. Because it's quite often after we've had a brain injury that our ability to change that focus becomes slower. Okay? And you don't have to remember that explanation, because I put all of these exercise sheets in the back of your package. Okay? The other thing that you can do is walking with head turns. We talked about making static or standing balance techniques harder by standing on one foot and turning your head from side to side. So you can also do your best Victoria's Secret model impression or Calvin Klein model impression, trying walking down a straight line and turn your head from side to side. Also, if you're having to walk down the aisle at the grocery store and look from one side to the other. So you can practice that in your hallway on the way to from the washroom. And the other thing that you can do is something called VOR exercises. VOR stands for vestibular ocular reflex. So our eyes and our head have to move or work together in order for us to maintain focus on an object while we move our head. Okay? So in the back of your package, you have a sheet that has a big X on it. And that's all that's on there. Okay? So what you would do is use that as your target. And either put it on your fridge, if sitting at the kitchen table if that's something that you can look at when you're sitting at the kitchen table, or if you like to sit somewhere in your den or living room at a distance away that this is crisp and clear. And then with your eyes on that target, I'm just going to pretend that my thumb's my target for now. I'm going to try and keep my focus on my thumb and move my head from one side to the other. And in the beginning, this might make you feel dizzy or nauseous. And so if it does, to make it easier, sit down while you're doing it and slow down your head turns. Okay? And then what you'll do is try and make it more difficult by either speeding it up or try it in standing. Yep.
When I focus too hard, my head twitches.
Mm-hmm.
So is that a good thing to do, or?
You and I need to talk later, because I know that was something that you and I had identified in triage, mm-hmm. and we were going to try and chat with the physician, or were we going to try and get you in to see Lutheran?
Yes.
Okay.
Yeah.
And had you made that?
No, I've got
a referral?
I'm not too sure.
Okay. How about when we're done here today, we'll go down and we'll look at your note again, so I can remind myself where we ended off, mm-hmm. and then we'll move forward from there.
Okay.
Yeah.
Thank you.
Alrighty. Mm-hmm. So there's lots of suggestions in the VOR exercise sheet of how you can make that activity more difficult or how you can make it easier. Okay? The other thing that you can do while working on these exercises is use your binasal occlusion. So if putting tape on your glasses is something that you identified in triage as being helpful for you, then use that while you're doing these exercises, because it's going to mean that you can sustain at that activity for a little bit longer and feel a little bit better afterwards. Also, using sunglasses if you have issues with light sensitivity, that can help to dampen down the stimulus and help you persist in activity for a longer period of time. If using a weighted compression vest or just compression only is something that was found to be helpful for you, then wearing those garments will be helpful while you're doing the balance or vision activities as well. Okay. And this is just, everybody's familiar with what is meant by binasal occlusion, the tape on the glasses. Is there anybody who's not? Do you know whether or not, is it just you? Anybody else?
No, I've seen them.
Oh, you've seen them. Okay. Everybody's good? Okay. All right. And then the other thing that you probably talked about in triage was using TheraBand compression, and if not, then the weighted vest. Probably went right to the weighted vest. Is there anybody who's not familiar with the weighted vest? Yep. Okay. So if you noted that you had issues with balance, do you have any changes in your balance since your injury?
I don't think so.
No? Okay. So that's probably why. Any issues with anxiety in busy environments? Okay. So this could be something that would be appropriate for you, and we can try that on after. And all it is a neoprene vest and has adjustable sides on it so that we can make it tight to your body. And by what we hypothesize happens is that by adding in that increased stimulus, it helps people feel more calm, or they have better balance performance. Similar to the idea of a thunder vest for a dog, or they use compression vests for children as well if they have issues with anxiety. Yeah.
And you supply those if you want them?
Yes. Yep. So we can try those on and see if that works for you. Just TheraBand compression, if somebody wasn't interested in purchasing a vest, that's something that you could try while doing your balance activities. You would need a second person to try and wrap the TheraBand to help you out. The idea is to try and cover as much of the limb as you can, so you're providing lots of compression. The reason why I'd say you'd only do this when you're doing a balance activity is the longer you hold it, the more compression it's supplying, and it might not feel very comfortable after a while.